Hi, this is Dr. Ilya Lengold, and today we're going to address the most frequently asked questions about eyelid surgery. The eyes and eyelids are the center of facial appearance, and eyelid surgery is one of the most critical and detailed types of facial plastic surgery. We offer world-class expertise in eyelid plastic surgery, performing over 1,000 cosmetic and reconstructive eyelid procedures a year. Blepharoplasty, the repositioning or removal of soft tissue from the upper or lower eyelids. Upper blepharoplasty surgery is performed through a cosmetic lid crease incision, allowing the surgeon to reshape the contours of the upper eyelids. Removal of the redundant skin allows makeup to be used more effectively and brings out the natural beauty of the human eye. Many patients have furrows or worry lines between the eyebrows that can be surgically improved at the same time the upper blepharoplasty surgery is performed. Lower lid surgery is usually performed from a hidden incision on the inside of the lower eyelid. Fat bulges in the lower eyelid can be sculpted and repositioned to give a more youthful, rested appearance. Filling in the hollows in the lower eyelids with either dermal filler or fat can also assist in resolving dark circles. Brown spots and fine wrinkles can be refined from the lower eyelids with a TCA peel or resuspension of the lower lids with a pleasing uplift to the outside corner. To improve the position of the eyebrows and forehead, an eyebrow and forehead lift can be performed at the same time or at a separate setting as eyelid surgery. With the forehead lift, the wrinkles of the forehead can be improved, creating a more pleasant and youthful facial appearance. Now let's answer some frequently asked questions. Will my insurance pay for eyelid surgery? Insurance will often pay for eyelid surgery that is performed to improve your vision or comfort of your eyes. For instance, if your upper eyelids are blocking your vision, your insurance company may pay for upper eyelid surgery. If the upper eyelids interfere with your vision, insurance companies require a visual field test to demonstrate peripheral vision loss and that the vision loss is improved by elevating the upper eyelids. If your lower eyelids are droopy, and this is causing eye irritation and watering of the eyes, your insurance company may pay for correction of this problem. Insurance companies typically require that the medical need be documented with photographs, which are reviewed by the insurance company during the pre-authorization process. Some problems like bags in the lower eyelids do not affect vision and are never paid by the insurance companies. Other problems like excess skin in the upper eyelids can affect vision when severe enough and are paid for by insurance companies when photographs and visual field tests document a medical need for the surgery. Many of the procedures we perform are done only to improve appearances, and these cosmetic procedures are not paid for by your insurance company. One of the goals of a consult with the doctor is to determine what procedures you may benefit from and to inform you on the costs associated with those procedures. Can droopy upper eyelids and droopy lower eyelids that cause eye irritation be addressed at the same time as the cosmetic eyelid surgery is performed? Yes, it is very common for patients to undergo surgery that improves function simultaneously with cosmetic surgery. The portion of the surgery that is done to improve eyelid function and or vision may be covered by your insurance company. Where is the incision made when performing upper blepharoplasty surgery? In nearly all cases of upper eyelid blepharoplasty surgery, there is excess skin in the upper eyelids. Removal of this excess skin is only possible with an incision in the upper eyelid. Fortunately, the skin of the upper eyelid is one of the thinnest in the body and typically heals with minimal scarring. Furthermore, the incision site can be hidden in the fold of the upper eyelid, allowing the incision to be inconspicuous while healing. Is fat removed from the upper eyelids when upper blepharoplasty is performed? Removal of too much fat from the upper eyelids can give one a hollow appearance that is not desirable. Often the fat pad in the upper eyelid adjacent to the nose is bulging forward and is reduced in size at the time of upper eyelid blepharoplasty surgery. This is done conservatively to get rid of the bulge without causing a hollow appearance. Can the eyebrows be lifted or the lines between the eyebrows improved with upper blepharoplasty surgery? Yes, this can be done through either an eyelid crease incision or via a forehead lift procedure. Who needs an upper eyelid lift versus an eyebrow or forehead lift? Patients with droopy brows, in addition to droopy eyelids, benefit from having their brows addressed at the same setting as their eyelids. This achieves the best functional and cosmetic result. If I have an upper blepharoplasty surgery, will I be able to close my eyes afterwards? Yes. The upper eyelids are central to form and to visual function. Removal of too much skin from the upper eyelids does not look natural and causes problems with lid closure. Given our unique expertise in both eye and plastic surgery, we're acutely aware of the need for the lids to look and function normally after eyelid surgery. Is an incision made through the skin of the lower eyelids when performing lower eyelid blepharoplasty surgery? Typically, the incision is hidden behind the lower eyelid and no visible scar exists. Most patients with bags in the lower eyelids have little extra skin in the lower eyelids that can be addressed with a TCA peel. Occasionally, patients with significant excess skin can have a conservative amount of skin safely removed from the lower lids. The bags are typically caused by extra fat or fat that is positioned abnormally. If significant amount of skin is removed from the lower eyelids in patients with little extra skin in the lower eyelid, the lid can droop, causing the whites of the eyes to show between the lower lid and colored part of the eye. This is called lower lid retraction. Lower eyelid retraction is a sign of aging and can create dry eye. Lower lid retraction from removing skin of the lower eyelids during blepharoplasty surgery is probably the most common complication of lower eyelid surgery. Lower eyelid retraction can be avoided by having a procedure with an experienced eyelid surgeon who is acutely aware of the amount of skin, if any, that can be safely removed from the lower eyelid. I have wrinkles and texture changes in my lower eyelid skin. Shouldn't this be corrected by removing skin from the lower eyelids? Patients often have wrinkles or texture changes in the lower eyelid skin. Texture changes cannot be improved with removal of skin from the lids without causing eyelid retraction. They can often be safely improved by performing a TCA chemical peel at the same time or following lower blepharoplasty surgery. I have never had eyelid surgery and I have droopy lower eyelids with white showing between the lower eyelid and the colored part of the eye. Can I still have cosmetic lower eyelid blepharoplasty surgery done? Yes, this is a common situation. The lower lids become loose with age, and in addition to removing the bags from the lower eyelid, the lid can be horizontally tightened and elevated to reduce this droop of the lower eyelid. For significant amount of white showing between the lower eyelid and the colored part of the eye, your surgeon may elect to put a very thin graft made to lift the lower lid on the back side of the eyelid. It is placed through the same incision used for lower eyelid blepharoplasty. Where exactly is the incision made to correct the bags in the lower eyelids? The incision is made through the pink lining on the back side of the lower eyelid. Using this approach, the surgeon can remove excess fat in the lower eyelids or reposition the lower eyelid fat into the dark circle in the lower eyelid. This incision is hidden behind the lower eyelid and is not visible. Does the lower blepharoplasty surgery simply involve removing fat from the bulges in the lower eyelids? It is often more complicated than that. Well-done cosmetic eyelid surgery needs to correct all of the problems that have occurred with facial aging to make the lids look more youthful. Some patients only have extra fat in the lower lids. This is typically not an aging change, as it is first noted as early as high school. This tendency to develop eyelid bags at a young age tends to run in families. In this situation, fat removal alone can often correct the entire problem. However, most patients develop bags in the lower eyelids because of facial aging. In this case, the changes that need to be addressed are more complicated than simply removing fat from the lower eyelids. Simply removing fat from the lower eyelids of an aging face can cause a hollow appearance, and hollow lower eyelids make one look older, not younger. What is the relationship between dark circles in the lower eyelids, bags in the lower eyelids, and facial aging? Several changes may occur in the lower eyelids that cause bags and dark circles. A youthful lower eyelid is full, short, and has no dark circle under it. With aging of the face, the fat from the cheek and the lower eyelid separates. This occurs because the cheek descends or droops with aging, which makes the lower eyelid look longer and allows the eyelid fat to move forward. This scenario creates an empty space between the fat of the lower eyelid and the fat of the cheek, just at the edge of the bone along the lower eyelid. This situation can be described as two mountains separated by a valley. The first mountain is the bulging lower eyelid fat. The second mountain is the drooping cheek fat. The valley lies in between. In overhead lighting, the bulging fat of the lower eyelid creates a shadow in the valley or dark circle at the intersection of the cheek and lower eyelid. How can lower blepharoplasty surgery correct bags and dark circles? The operation needs to be customized to each patient. In many patients, the result is best if the drooping lower eyelid fat is transposed as opposed to being removed. In some patients, the result is even better if the drooping cheek or mid-face is also lifted. In some patients who have significant hollowing or dark circles, fat transfer or grafting must be performed instead of fat repositioning, since there may not be enough fat in the lower eyelid to fill the dark circle. What is fat transposition? Fat transposition or repositioning involves moving fat from the lower eyelid into the valley between the cheek and the lower eyelid. In other words, the fat from the lower eyelid is moved down to fill the dark circle. What is fat transfer? Fat transfer or grafting involves taking fat from another part of the body, belly, outer thigh, inner thigh, etc., via minimally invasive liposuction and transferring it to the dark circle in the lower eyelid. The fat can also be transferred to other facial areas in need of volume restoration, such as temples and cheeks, for a more youthful appearance. Where is the incision made to lift a drooping cheek? This varies from patient to patient, but it may be made either in the upper eyelid, the lower eyelid, in the crease at the front of the ear, or behind the temporal hairline. You should discuss this with your surgeon. What is recovery like after eyelid surgery? Recovery varies depending on the exact procedures performed and the individual patient. Generally, eyelid surgery results in bruising and swelling of the eyelids. We ask that patients plan on being at home on the day of surgery and 2 additional days afterwards. During these first 3 days, cold compresses are applied to the eyelids to reduce bruising and swelling. After the 3rd day, most patients can drive a car and get about without much difficulty. We ask that patients avoid heavy lifting and strenuous exercise for 2 weeks after the procedure. Most patients will wear sunglasses for 2 to 3 weeks to hide bruising and swelling. We will provide you with detailed written instructions prior and after your procedure. Who should consider having a brow or forehead lift? Patients frequently seek correction of droopy eyelids, not realizing that the eyebrow droop is causing part or majority of the issue. Since the eyebrow descent results in appearance of excess skin in the upper eyelids, patients who need an eyebrow or forehead lift nearly always present requesting upper eyelid surgery. When they relax their eyebrows to their actual position, extra fullness appears in the upper eyelids. Do all patients with extra skin in the upper eyelids need eyebrow or forehead lift? No. Patients who request upper eyelid surgery can be divided into 3 groups based on recommendations for forehead or eyebrow lift surgery. The first group does not have droopy eyebrows or forehead and does not need eyebrow or forehead lift. The second group has mildly droopy eyebrows, would achieve a much better result from upper eyelid surgery if eyebrow or forehead lift surgery is done at the same time. In this group of patients, an internal brow lift is often recommended. The third group of patients have moderate to severe droopiness of the eyebrows. Close your eyes and put your fingers on your eyebrows. If your eyebrows fall below the bony orbital rim, then you are in the third group. This group of patients will not get a good result from upper eyelid surgery unless something is done to elevate the eyebrow or forehead. If only upper eyelid surgery is done in this group of patients, it will lower the eyebrow while raising the upper eyelid. A low eyebrow with a high eyelid crease makes one look angry, which is never a desirable outcome from facial surgery. In this group of patients, we typically recommend a forehead lift at the same time as eyelid surgery. What is an endoscopic forehead or brow lift? This is a method of lifting the eyebrows and reducing wrinkles in the forehead with the use of an endoscope. It is a small incision and rapid recovery procedure. Where are the incisions made for endoscopic forehead lift? One set of incision sites is made behind the temple hairline. Another set of incision is made behind the central hairline. The incisions are 1/2 inch long and are nearly invisible as they heal behind the hairline. This pattern of incisions is adjusted for men with male pattern baldness, and the procedure can be performed on men with very little hair. What is an endoscope? An endoscope is a surgical instrument that has a light source and a camera built into the same device. The instrument can be inserted through small incisions, allowing surgery to be performed in a less invasive fashion. In addition to its use in cosmetic surgery, this device is utilized in sinus surgery and other functional procedures such as tear duct surgery and orbital decompressions. How does the endoscopic lift elevate the brows? The attachments of the soft tissues to the bone are loosened with the use of an endoscope. The brows can then be lifted and fixed in a higher position and more natural position. What is the main benefit of the small incision endoscopic forehead lift? The endoscopic forehead lift has high patient and surgeon acceptance because it allows surgery to be done with a quicker recuperation and less chance of a visible scar. What is the recovery like after the forehead lift surgery. Most patients undergoing endoscopic forehead lift surgery will simultaneously have eyelid surgery. Eyelid surgery typically causes more bruising and swelling than the forehead lift surgery, so the recovery is limited by the 3 weeks it typically takes for the eyelid bruising and swelling to resolve. The small staples in the incision sites behind the hair are removed about 2 weeks after surgery without pain. Patients may shampoo the hair the day after the surgery, but should not scrub adjacent to the incision sites. We ask that patients avoid hair coloring or other harsh chemicals in the hair for 3 weeks after surgery. Many patients who have forehead lift surgery will temporarily get numbness of the forehead. The numbness typically resolves over a course of several months. Will I look surprised or natural after forehead lift surgery? No, forehead lift surgery aims to reposition the droopy eyebrows to their normal anatomical position, as well as reshape the brows to create an aesthetically pleasing appearance. The goal of the surgery is to reverse the look of sadness, fatigue, concern, or anger that results from mispositioned eyebrows and forehead wrinkles. What is an internal brow lift surgery? This is a method of lifting the eyebrow using the same incision used to remove excess skin from the upper eyelids. How does an internal brow lift elevate the brows? Tissue that holds the eyebrow down is released, allowing the eyebrow to move upward. Sometimes stitches are used to support the eyebrow in the higher position. Will an internal brow lift improve my forehead wrinkles? No. To remove wrinkles in the forehead, one must lift the forehead as well as the eyebrows. Will insurance pay for forehead lift or internal brow lift surgery? No. Will the insurance pay for eyebrow lift surgery? In our experience, insurance companies will pay for eyelid surgery when it impairs vision. Some insurance companies will pay for a direct brow lift. A direct brow lift involves making an incision directly above the brow. While this is an effective procedure, it can leave unacceptable scars. Therefore, a direct brow lift is not our preferred method for lifting the brows. What are the advantages of the internal brow lift surgery over endoscopic forehead lift surgery? An internal brow lift can be performed through the same incision as the upper blepharoplasty surgery, so no additional incision needs to be made. An internal brow lift is also less expensive. What are the main advantages of the endoscopic forehead lift over internal brow lift? An endoscopic forehead lift is a facelift of the upper portion of your face, while an internal brow lift just elevates your eyebrows. An endoscopic forehead lift reduces forehead wrinkles, reshapes the brow to a more natural appearance, and provides a greater lift of the eyebrow in contrast to an internal brow lift. An endoscopic lift can also lift the crow's feet area just adjacent to the outer corner of the eyelids. In contrast to an internal brow lift, endoscopic brow lift allows correction of the downward slanting of the eyebrows and asymmetrical eyebrows. What are the corrugator muscles? These are the muscles that create vertical wrinkles in the area between the eyebrows, glabella. Patients do not like these wrinkles as they can make one look concerned, intense, or angry. What can be done to get rid of vertical wrinkles between eyebrows? These wrinkles can be reduced by weakening the corrugator muscles with either Botox or surgery. Botox requires repeat injections but no recuperation period. Surgery is typically only performed once but requires a period of recuperation. Where is the incision made to remove corrugator muscles? The incision for upper blepharoplasty surgery is used to remove the corrugator muscles. What is recuperation like after corrugator removal surgery? Most patients have upper eyelid surgery done at the same time. This results in bruising and swelling that typically resolves after 3 weeks. Patients may also get some numbness between the eyebrows, forehead, and scalp after this procedure, and this can take several months to resolve. Can these surgeries cause complications? All medical procedures have some risk. You should discuss the risk of complications with your doctor prior to surgery so you can make an informed decision on how to proceed. Many patients select Langold Institute for Plastic Surgery for their procedure because they believe that the risk of complications with cosmetic and the reconstructive plastic surgery may be less when the procedure is performed by very experienced surgeons with specialized training and expertise in plastic surgery of the eyelids and face. Please do not hesitate to discuss any questions or concerns you may have regarding surgery with myself, Dr. Eyelid Langold.